Welcome to another episode of the Altered Attitudes podcast, where we delve into the intricacies of addiction and mental health. This episode hosted by Rehabs UK Managing Director Lester Morse. Today we've got a very special guest joining us, Dr. Ike Neene, a distinguished GP and good friend of Rehabs UK. Dr. Nene's dedication to aiding those battling addiction is one of a holistic understanding of the wider issues that can lead us down the path of addiction. Lester and Ike explore the merits of veering away from the relentless dependencies on medication in addiction treatment. Instead, they navigate the realms of holistic methodologies, shedding light on the intersections of addiction, depression, and the importance that acceptance and personal growth plays in recovery. Join us as we embark on a journey towards understanding a more comprehensive approach to tackling addiction and mental health issues.
Hi guys, welcome back to another episode of Altered Attitudes. We're blessed and lucky enough today to have a doctor. Don't often get doctors for a podcast. This is Dr. Neene, Ike Neene. He's worked with us for quite a few years. What we find, not many doctors really have a good understanding of addiction, but with the client feedback, Dr. Neene, has done a great job, and so we've invited him along to share some of his experience, his professionalism about addiction, and from a would you call yourself is it a GP or doctor?
I am a GP, family doctor.
From a GP's point of view, which is one that they've usually only got 5 minutes, so we've got him for an hour, so we can ask a few more questions. So before we start, can you have a quick look at me here? I bet you get that all the time, don't you? Yeah. Even the joke.
No, it's fine.
But anyway, welcome.
Thank
Dr.
you.
Neene.
Yeah, it's good to be here.
You've been very good for our rehab over the years and what we're doing now. So we appreciate you and your hard work and your insight. And again, like I say, we can always get good client feedback, which is always important to us because
absolutely
we sort of go on that. So we'd like to start the podcast, maybe get a bit about your background. Firstly, what sort of led you to be a GP, but then also after that, kind of what got your interest up in addiction field?
Yeah, well, general practice is family medicine. It's the ability to look at, really all members of the community from the cradle to the grave, really. It's something that I got into a good few years ago. I'd been actually working in obstetrics and gynecology in the earliest stages of my career, and I had a look at general practice as an option, and it really appealed to me because of the ability to, the breadth of patients that we see, and the ability to really look at all aspects of medicine. So I really enjoy being a general practitioner. It certainly gives you an understanding in, really all aspects of care. And certainly in my particular experience, I just feel that it gives me a great opportunity to treat the whole individual. You see different people at different stages of presentation and illness, early stages of disease, late stages of disease, and you're involved. And I suppose the good thing about general practice is that you can decide to develop an interest in whatever area that you like. And certainly addiction and mental health is an area that I feel is so important, and it's certainly an area that I've found a great deal of satisfaction in working with clients, and certainly working with yourself. So mental health is fundamental to everyone's existence. You could have excellent physical health, but if your mental well-being is less than satisfactory, then you're not well, and that is something that we see time and time again, and it's important to be able to understand issues relating to mental health. It's important to be able to appreciate what is driving people's mental ill health, and adopt useful and practical means and strategies to help people. And I think it's an area that has a massive, certainly massive value, and certainly anyone who has come across anyone with major mental health issues will testify to the importance of sorting it out. And even when we think about our own individual experience, we know how things are when our mental well-being is less than optimal. And certainly if you consider that certain individuals are dealing with challenges in their mental health on a day-to-day basis, day in, day out, and then you really want to be able to make things better for people, give them an understanding, give them a path to wellness. And I think it's quite powerful and very satisfying.
Yeah, I've got a lot of questions there, but well, because I think when with like somebody like myself who's probably focused on addiction for probably most of my life, really, in one way or another. So there's quite a lot of interaction with doctors and they're working in a rehab and in that industry. There's often a lot of medications that are prescribed and passed around. Now again, so mental health and addiction and family dysfunction have all become probably the main three topics that I've become most interested in. But especially at this point, you've been noticing on the news that again in sort of beginning of 2024, the explosion in, especially with children with mental health problems, not to mention the rise in addiction problems, rise in all kinds of mental health problems, suicide, self-harming. And that's always going to have a knock-on with the younger people, which, it's on the news quite regularly now, how concerning it is. And it seems like everybody's on more and more on medication, which is always concerning.
Yeah.
And I've had a few sort of conversations with doctors, not to this point usually when I'm doing a talk on addiction, but I always kind of ask why they prescribe some of the medications they prescribe, because again, from my point of view, where I believe that there's lots of other treatments for mental health problems that are probably a little better than medications. But without the absence of them treatments, then medication usually seems to be the kind that's offered.
Well, I think the role of medication is huge in certainly when you look at medicine in general, and certainly mental health. Medication is part of how mental health problems are addressed, and certainly most guidelines for most conditions, there is somewhere that they'd say, this is the medication to use, and in many ways that is how we have, you could say, been brought up as medics over the years. A lot of the protocols require medication, and that is what most most doctors are used to. Now, I think there is, however, certainly a growing movement of specialists and of interest looking at the role of other interventions that don't rely so heavily on medication to kind of achieve you could call it a more holistic recovery and restoration of good mental health. And there are definitely, when you think about mental health and most diagnoses, there are things that can be done that are kind of can be used in addition to medication. And we're talking about things like lifestyle interventions, managing managing individuals, things like diet, and exercise, things that people can really approach on a day-to-day basis. Kind of mind management, understanding self, understanding the origin of mental health and mental illness, and approaching it from a psychological perspective, and using other additional methods such as the so-called kind of mind, body techniques, things like meditation and being in nature, and various other things that don't rely so heavily on medication. But I think the challenge, I would say, for the medical establishment and certainly society is that we have come to this place where when someone has got a problem, for instance, maybe has got features of depression or anxiety, then people are thinking, okay, I need to go and get something from the doctor to sort it out. And a lot of times, if the doctor is maybe not very quick to give something, then people feel a bit, I thought I was going to get something. But I think the emphasis, in my view, has got to be more of, holistic approaches towards mental health. And I suppose the only way you can do that is by understanding why are people, where has this, mental health challenges, where have they come from? What is going on? And understanding the neuroscience of wellness, the neuroscience of depression and anxiety is I suppose is quite central to that. There is a great level of understanding that's been kind of developed over the last few decades in terms of why people get mental illness and why people.
Sorry, could you stop? Is there a scientific or a reason? Can you define the difference between somebody that may actually have a chemical imbalance that I guess is all of the yoga and painting in the world's not going to really do much good, or going into nature, or the people that actually just have an emotional problem that's kind of tipped over, that can sort of be restored by meditation, yoga, therapy? So I guess that's not going to work for. Yeah. Is there some way of defining? Is there a difference in people?
Well, it's an interesting question, but you see, the question about chemical imbalance as being at the heart of depression, for instance, that was put forward as being the basis. And yes, the understanding of neurosciences gives us an awareness of the role of things like serotonin and noradrenaline and various other neurotransmitters, and obviously medication that affect the balances of these neurotransmitters can have an impact on mental health. But I think when you actually look at it very critically, mental illness is really you could call it the way I tend to see it, it's a construct within the mind of the individual. So how does that person see themselves, and how does that person see the world? And that is affected by a whole load of things that have gone into that person's mental and psychological development. So I think it's my view or my opinion on the origins of mental health, which is backed up by a lot of the science, is that people develop, start off from conception through pregnancy, delivery, childhood. There are various inputs that are going into that individual. Sensory inputs, experiential inputs, what their mother was telling them, what their father was doing when they were small, what kind of interactions they had in the family, those kind of things. And those inputs end up being, almost being translated into pathways, and it's like the brain and the mind is able to create a learning pathway. But it's let's put it like this: it's a bit more complicated than we actually give. We're actually able to understand, in the sense that pathways in the limbic system, which has to do with the emotions, are created by experience, by things that happen. So it's almost as if you've got this thing that controls who we become, but it's all about what's, you're talking about genetics. Obviously, someone has got a genetic predisposition, and then environment, which includes everything from the intrauterine environment to the nutrition of the mother to the experience during pregnancy, how healthy the mother was. Also, you think about what the mother took in terms of medication and exposure to toxins and things like alcohol. And then obviously when the child is born, what was going on? Were there any infections? Was there any? So there are a whole load of things that are going into that individual that are affecting the way the brain, you could call it the hardware of the brain, is being laid down. And then also the you could call it the software as well, as in the brain is laid down in a certain way depending on what goes on in utero. But then also the impact of those experiential things literally affect how the individual sees the world, and that kind of has a bearing on how their mind develops and what personality they get. So it's pretty complicated stuff. But the point, going back to your question on chemical imbalance, the chemicals or the neurotransmitters are always going to be, there's always going to be that kind of role of neurotransmitters. And if you try and define a condition based on and I know people have done research looking at, in animal studies, looking at levels of, they've done some pretty interesting research looking at various levels of neurotransmitters in the brain, and they've used various scientific methods and models to try and demonstrate this. But at the end of the day, it's all about, what is happening to the thoughts, the thought processes, the emotional, the generation of emotions, which at the end of the day is down to a pathway. So it's all kind of linked together, in the sense that people who are, for instance, prone to certain behavioral tendencies, like maybe anger or anxiety, there's a pathway for that, and that's determining what they do. People who are prone to feeling despair, or talk about suicide, there's a pathway that's saying this is how I should be acting at this point in time. So the point here is that we are subject, or all of us really are subject to those kind of neural pathways, which are determined by a whole host of things, including what we've experienced, what we've come to learn, what we kind of know on a subconscious level and we consider to be true. And then you combine that with knowledge and experience and the things that are going on. So it's pretty complicated.
Yeah.
It's pretty complicated. And I think the assumption that certain conditions have got a chemical imbalance while others don't is, I would say, is a bit of a misrepresentation of what it is, because at the end of the day, the chemicals in our brain, the neurotransmitters, are working all the time. And depending on what, for instance, someone could go through a massive, kind of trauma, like a bereavement, and they feel a sense of sorrow, a sense of, despair, they feel sadness. And at that point in time, the pathways are generating that reality in the individual. Now, if that individual now is able to somehow get comfort and get support, which creates an alternative narrative in their mind where they feel
That
loved
would be
and
from
support.
their environment.
Absolutely. Then the impact of that bereavement is not as severe as if, the individual is subject to further trauma and, abandonment and feeling bad. And obviously, what people or how people respond is going to depend on, or is a lot going to depend on how they were prior to
I guess
the
if
thing.
just sort of thinking as, whenever I say things like that, there'd be somebody saying, well, I got a lot of loving people around me, but I'm still depressed. I'm still got these problems. That's not for everybody. Because again, I think even when you're saying it's genetic, so it's also not just the environment, it's your response to the environment. I like to say it this way, it's your ability to respond to the environment, it's your responsibility, which nobody really likes it when you go down that path.
You're right.
But it's, it's how you're responding, and then why are you responding in that way?
In that particular way. Yeah, no, I think you make a valid point, because there is, when you think about it, you can have a group of people exposed to trauma, like for instance, maybe a road traffic accident. Some people might have a fracture, some might have, might have gone through the trauma of that, and they basically recover. And then someone else who was involved in the same accident, that becomes the touchstone for a change and mental health issue. So you think, what's going on here? Both of them are involved in the same. Like some people, survivors of, even things like, war or refugee, refugee status, trauma, even things like sexual violence. Different people handle it differently, but I think it's really down to the way that the individual is able to conceptualize that thing and what impact that trauma is having on their sense of self and their sense of who they are. And that is something that, in my experience, is subject to it can be improved or modified based on things like, therapy, based on, compassion and kindness, and interjecting and creating an alternative narrative to what the person is going through.
So I find in my field, and a lot of people are just short of information that they don't understand, and so their map of the world, or the narrative they have in their mind, is often inadequate to respond very well. So they're left quite vulnerable.
Yeah.
And so you see it quite a lot. People recovering from addiction where they've come from difficult backgrounds to begin with, which seem to not have very many problem-solving skills in their background. They come with all of these diagnoses of different problems, but often when they stick around and start doing some of this stuff that you're talking about and getting some better information so they can make better decisions, more informed decisions for their life, a lot of them problems do go away from people, and they do start evolving. I've really sort of become about foundations. If you haven't got a good foundation, which again, like you're saying there, from your childhood, or my parents were not good problem solving skills, especially emotional problems. They were shouting, screaming, split up.
Yeah,
they didn't, and still in their 80s, not good at solving. The way they've solved their problem is kind of stay out of relationships for the rest of their life, which again is, I think, a sad thing that a lot of people,
end up doing.
Yeah, that because they don't feel loneliness in the way I guess some people do. Some people you find are lonely, but they're not very good at establishing relationships. So when you meet them, you say, "Why don't you go to the church? Why don't you go to join the golf club? Go where there's people and become a part." But they don't have the foundation to let them enter into that. So it's so uncomfortable for them.
Yeah. I think that you make a very valid point, because I suppose my my approach to anyone with a mental health issue is one of optimism, and I suppose that's a reflection of who I am, and I am coming to people. If people who I see in my general practice, I'm thinking, okay, what has created this subplot or this story in your mind? What has contributed to that? Now, and a lot of times, as you say, it might be repeated trauma, repeated negative experience, repeated problems that have almost made them feel that there's nothing for me here, or I'm generally not worth it, or I can never do well, or I'm surrounded by problems. So that is their belief. And for you to overcome that, you've got to, in my opinion, create an alternative narrative. And that is why you can get people who have had addiction problems for years. Then when they come across something that tells them that, oh my goodness, there is hope, then that literally injects some hope into their life, and they're able to hold on to that. Meanwhile, they're trying to figure out their stuff, figure out their issues, but they've got something almost like a lifeline to hold on to. So while they're trying to sort out all the stuff, then they can hold on, and then with time, it gets more meaningful, and then they can get into a place whereby they start doing things that literally reaffirm what they've been told is possible, and then their life moves forward. And if they've got the benefit of psychological support, maybe a significant other or family or friends, then it reinforces that, and then they're moving in the right direction. But it's very, very complicated because the truth is, you could even where you've got people with family and friends, at times, and in some people, what they do is they put a lot of hope and a lot of attach a lot of significance to the approval of a family member or a family, spouse or whatever. And if that person disappoints them in any way or says something, then that can be really hard for them to deal with. And it literally takes like a pickaxe to their confidence. And they say, oh, you're all the same. This is what I'm used to. So it's quite a fragile, gentle thing. But as people get more confident, and as people embrace what I will call that journey of recovery, and that process of building themselves up, then things get better. It's fascinating stuff.
It is. I'm trying not to be too negative because again, it's like, just thinking as a GP and people, I was kind of lucky enough that I turned out that, again, I was a lot more than this, but it was a good catalyst that I had an alcohol and drug problem, and I ended up at 25 years old going into an AA meeting. Now that environment that you was talking about, that I found that there, that in that group was people that believed what you're saying. They encouraged me, they supported me, they comforted me. I learned to trust them. I could go to them with problems. I still do. 33 years later, I rely on, because again, I realised apart from all of the emotional issues and being a very sensitive kind of soul to begin with, because in growing up in a very dysfunctional family, but I realised how ill-equipped I actually was to deal with most of what they'd call normal life situations. I'm the kind of person, I feel comfortable around drug addicts, around villains, around the people like middle class, nice people. I feel uncomfortable, and less and less the older I've got. But I felt intimidated, and then I would start becoming intimidating because I felt less than. So again, because I had a lot of people, I found that support through my AA group. I'm also quite aware that a lot of people don't have that. And our society, because again, listening to it, two things sort of come in my head is like, it's a lot easier taking a tablet. But also, we see on the news, the mental health failing, they're overwhelmed. You know, that kind of help isn't readily available for people, especially when they're depending on like the NHS to supply it for them. And when you're surrounded in a very dysfunctional, never mind family, but in community. See, I kind of found that support in another community, and again, I guess people can find if they walk in a church or something like that you find people that are a little bit more positive, probably still crazy. I mean, they're all still a bit crazy in AA, in church, they like going to church, they're all still a bit potty, but at a lot higher standard of life and a lot more positivity, a lot more hope, and that we can get through this, because again, it's not like you get an idea of a tablet you're going to take and it's going to fix you, but it doesn't. You have to keep taking it, and and it's the same with this development. You've kind of got to keep taking it and keep practicing at it, and when you get knocked down, get up again and keep pushing.
Keep pushing. Yeah. Well, I think the whole concept of an antidepressant can cure my depression. As I said, not to be negative about the people who've been helped by antidepressants, but an antidepressant can prime you to get better, maybe, if it doesn't give you too many side effects. But the real improvement, when you think about it, comes from your experience and your ability to conceptualize your life in a positive light. Then that's when you know you're better. And when you start engaging with life in a way that's more meaningful, in which you look around, you see your spouse, you see your children, you see your work colleagues, you see your community, and you can engage with them, then that's when your mental health problem is better. You can, if you think that, and this is what I tell people, I say, well, I could prescribe you an antidepressant, but if you don't have any concept of wanting to try to almost, get the other things that, feed into your mental health kind of environment, or feed into your mental health reality, if you're not willing to look at that, then it's going to be hard. And so at times, I mean, I've spoken to some people in the past about the need to, sort out past trauma, the offense that is literally giving them anger. And, how do you do that? How do you deal with your past? And at times it might have to do with allowing compassion to come into your heart, allowing a sense of, dare I say, forgiveness to come into your life. And that forgiveness is for not just for others, but for self as well. Because, I messed up, I'm no good. Yeah. You've got to embrace that thing on a realistic level for it to start to speak comfort to you. When you're alone, you feel comforted by the fact that I'm actually doing the right thing.
Yeah, when I get angry, I change.
Yeah.
Like I don't even like being in myself.
Yeah.
And again, in AA, it tells you that resentment is the number one offender, but forget what that book says. If somebody upsets me, and again, I'm very sensitive, I can switch. Like, you can see, my wife says I shrink as well. She says, I can see you shrinking. It really has such a massive effect on me, being angry. Then I start ranting, and it's like almost like a fog could come over me. And when I was younger, it was quite frightening. Like, people call it the red mist.
Yeah.
And you just didn't care what happened to you.
Yeah. But you see, that is about, talking about emotional management. And that's why emotional management is, I would say, one of the big keys to mental well-being. Understanding who you are, understanding you could call it triggers or buttons, and being able to some degree, manage that in a way that is acceptable to you. Now, for some people, some people will say, you know what, I've got an edge to me, I've got a temper, just don't go there, just don't press the button to release it, and then we're good.
It's impossible in this world.
Yeah, but the point I would say for a lot of people is, you've got to appreciate what is the best version of yourself that you want the world to see. Now, if I tell people, you see, I've got all this, I carry around with a briefcase of, I go around with a briefcase of anger. As long as you don't upset me, then my briefcase will remain closed. If you upset me, boom, it's coming out. And I tell people that is, I suppose, one way to live your life, but maybe the better way is to kind of reduce the volume of that briefcase and, you know, replace it with a little bit of, maybe a little pouch of it that to use when necessary, and carry around something that's more beneficial to you, compassion and empathy and love and kindness. And then the good thing about when these things are flowing out of you, you're better. You're a better person. You're much more likely to have good mental health. But as I said, it's not for everyone.
Well, you'd have to have the pathway to begin with. I think for me, coming from an angry family, and being an angry person, it's something, again, I had to develop. But again, I kind of had to be aware and accept that I had to develop it, because I think just even like forgiveness, which I'm obviously a great believer in, but I've also realised over the years, just it's not something that you can just say, I forgive this person that's abused me for 20 years, because again, I've got the pathways. I've still could have them habits that need dismantling.
Yeah.
And again, I found that, you know, it's not an easy, you know, to redevelop new pathways, because and again, because I believe what you're saying and I practice it, I'm astounded that I keep coming across things as I'm going along, interactions with people, and thinking, even sometimes I've been telling people lately that, you know, it's when things are hidden under virtue. For example, I'll say, you know, that person's sort of doing something that's bothering me, but I'm being forgiving or tolerant or patient. But then I realised, no, the truth is I'm afraid of confrontation.
Yeah.
and you get there that...
Yeah, I think they're difficult things to kind of get your head around. And I suppose that is why, you know, life is a school, you know, really. You keep on learning how to improve and how to manage what's coming at you. But I suppose if you approach life with almost like a set of values and foundations, as in, this is who I want to be, this is the standard that I want to maintain. I'm not going to, I think an important one is, I'm not going to be determined, or how I show up is going to be more about how I am as against what someone else did. If I react based on what someone else does, if someone is able to trigger me or manipulate me like a puppet, then that person is literally controlling me. And I tell people, you want to be able to control yourself, as you say, responsibility. You know, you take responsibility. And so someone who says, oh, the reason why I'm like this is because of this person and that person and the other person, and they give reasons why they're so upset or they're so sad, and they literally give you the chapter and verse as to why they are the way they are, but they kind of don't want to, or they're not willing to contend with or even contemplate an alternative path. But because the abuser or the tormentor or whatever is out there, they're like, I'm justified to be the way I am. That in many ways, that is how they're going to live their lives. But I think we've all got what I'm going to call a higher place to ascend to, which is not easy. I'm not for any minute suggesting that someone who's been through trauma, all of a sudden they become, like a saint. But the point is, as you learn the meaning of love, as you learn what compassion does for self and others, as you learn how to really make forgiveness work for you, and it literally gives you that assurance, and it gives you that sense of, I am good, Now, everyone around me can be going crazy. It doesn't mean I have to go crazy. Now, that is basically a higher level, and I would say it's something that we all need to work towards. The truth of the matter is that emotional reactivity is part of what makes us human. And if we lost the ability to get angry, or we lost the ability to have fear, or we lost the ability to be worried, then that's not good. Because obviously, if you are approached with a scary situation in which the answer is to run away and you'd have no fear, then the consequences could be pretty dire. You're crossing the road, but you have no fear of coming traffic. Then that's a bit worrying. So the point here is that emotional reactions and responses are useful, but they've got to be measured. It is appropriate to respond to someone does something that's not nice or that is unpleasant. Yeah, you can get upset about it, but that getting upset should not now replace your, kind of take over your life and take over your, the essence of who you are. Or someone said something to me yesterday and I'm pondering on it, I'm thinking about it, I'm literally, it's in my head, I can't get it out of my head, I'm thinking, I'm brooding, I'm upset. And so I go into the day feeling upset, thinking about what someone said yesterday. And so basically what I'm telling myself is that for today, even I may come across people who are good, who are kind, who are loving, people who will validate me, people who will love me and care for me. I'm not interested about that, but I'm interested about what someone said yesterday. And for some people, it's not yesterday, it's 50 years ago, or 6 months ago, or when they were 10, or when they were 17, or with their first relationship. And so those things become what their life is all about. And so I will tell anyone, and I'm telling anyone, I'm telling myself, I want to live my best life. And my best life, I know, is when I'm acting out of, compassion and kindness. My best life is not when I'm acting in anger or frustration. Obviously, anger might be necessary to deal with something that's come into my world or come into my space. And I say, I don't like that, and I'm going to walk away. But then if that becomes the sub-theme for the day or the week or the rest of the year, then I don't think I'm doing myself any favors. So, and that is where I think, emotional management is something that we need to really encourage people to embrace. I mean, the people, and I would say the people who have got good mental health, in my opinion, are the people who understand how to manage their emotions. They know when to get upset, but they don't allow that to become their new identity. They know when to love. They respond to gentleness. They respond to kindness. They respond to, apology. Someone says, "Oh, I forgot that it was your it was your birthday." Then they take that as good as against, "Oh, you forgot it was my birthday," or "You forgot this anniversary, so for the rest of the week I'm not talking to you." I was like, well, how do I deal with that? So I now have to negotiate and find a way to get around that obstacle. If I didn't put that obstacle there, then then it would be easier. So I think it's all about how we tend to live our lives. But I would say to anyone, let us learn to bring out the best in each other.
How would you find people respond to that in a medical, when they come to you as a GP? Because part of me's thinking, do you get many patients come back?
No. Well, the thing is,
I mean, I think it's great what you're saying, but it's not
people,
what you hear from GPs generally.
Yeah. Well, I would say to anyone, you see, different people are different as to how they approach these things. And there've certainly been some people who have been upset that I even talked about, "Oh, how dare you even say that I should forgive my abuser? How could you even mention that? You're very unkind. I literally think you shouldn't be practicing." And I'm thinking, well, okay, the point is this: the abuser has done what they've done and they're living their life. The abuse is saying what it's saying to you, and it's having an impact. And the person who abused you might have even forgotten about it and has gone on to something else. But that abuse is still speaking, is still having an impact. And because you can't let go of it, it's still live. It's almost like you've been putting fertilizer and nutrition to that thing. So it's a living entity in your life. And I would say to anyone, develop the things that are useful, and the things that are not, let them, forget them. But if you keep alive the thing that is not useful to you, just for the sake of the fact that you're not willing to forgive, then I'm not sure who is benefiting. The only person who is missing out is you, because you've somehow kept that offense alive. And when you wake up in the morning and you remember it, then it brings you down. It gives you anger.
It makes you ill.
It makes you ill. And so I've had people certainly who have been upset and I would say to anyone, it is, anyway, let me put it like this. Obviously, as a doctor and as a, someone who is addressing, a patient who is feeling vulnerable, and you've got to, I would say, and I've learned this, you've got to pitch your kind of counsel in a way that is not likely to turn people off or maybe think that you're just some kind of, idealist and you're unrealistic, you're not living in the real world, and but you've got to, I would say, try and, I would say these concepts, in my opinion, and as I said, it's kind of how I live my life, and it certainly helped me to deal with the challenges in my life, that people need to understand that there's a best version of themselves that they can bring forth, and there's also a version of themselves that they can stay at. Now, it becomes a question of who do you want to be? And if you're willing to be honest with yourself and say, I would rather be the person who is happy and bringing out love and joy, as against the person who is angry because of what someone happened. Now, obviously, the process of therapy and recovery and dealing with the past is one that is different for different people. And for some people, it takes a lot of time to really kind of correct some negative impressions. And we're talking about addiction. If you've been in a place where that trauma has led you to self-medicate using drugs and alcohol, and that has led to more trauma, then it's almost as if you've gone from this point to this point to this point to this point, and that was the original thing, but there've been so many other pit stops on the way that have not been good, and it's created an overall negative picture, such that at times you may even forget that was the original thing, but there've been so many other negative things that where do you start? So it's an interesting thing. So that's why recovery is such an important, dare I say, kind of heart-centered work, in which you've got to try as much as possible to understand the journey of that individual and help them to find a way to diminish the impact of the problems that they've had, and kind of interject something that will create, take them off that road of despair onto another road where things can start to look better. It's not easy, but it's definitely worth the effort, in my opinion.
Yeah, I'm going to give testament to that, because again, that's exactly everything you said there was the way my life's gone. So it's like I'm not really too concerned what anyone else believes, to tell the truth, because I know that's how it worked for me. I had a 12-step program that helped me deal with my resentments, my anxieties, my fears, the blames. And again, people can take umbrage to this, and I get it, because I did at the beginning. But it's saying, it says self is the root of all your problems, and people really don't like that. Like you said, it's like, look, you taking that abuse, but you're the one that's constantly fanning it, nurturing it. And if you start taking action to overcome it, there's a good chance you will actually overcome it. But if you demand your right to have it, then there's not a lot anyone can do. And again, so, saying that myself is what's causing most of my problems. Not all, but a good enough amount to say, if I deal with them ones, because, again, working with people over the years with, say, something like depression, and you say, well, let's have a look at your lifestyle, your diet, You know, what are you doing in your life? When you actually work it out, and again, this is where I sort of think that sometimes just lack of knowledge is a big problem for people to show them. Look, that depression in that sense is, to me, it seems like that's a very healthy emotion. Because if I got the healthiest person in our country, and then I got them to live your lifestyle for a month, they'd probably feel depressed. So even if you do have a chemical imbalance, you could make that a hell of a lot better by changing a lot of these lifestyle habits or adding some more healthy. Now again, I know that can be difficult for people that are already in that very depressed state. And again, when people come to rehab or join a group, you're lucky enough to have people around you that can almost be like life coaches and things like that. They can encourage you and you know, keep getting you to stand up. And because you do find for a lot of people, especially with anger, you know, they realise I've got to stop this anger. It's so destructive to my life. And then they may go along for a little bit, have a bit of a relapse, get angry, but, you know, come back, have a review of it, take another little bit off, have another go. And it can take some years for people. But again, I think it's if you understand this stuff and believe it, at least, you know, you can start the journey and you can improve your situation. And you're not going to go straight to the top, but any improvements
is worth it. Absolutely. And I think that is why it's so important to surround yourself with people who, you know, believe that there is, you know, that recovery is possible. You know, if you surround yourself with people, certainly, I mean, working in you know, with people in your organization who have been through lots of you know, challenges, or who have been able to go through the recovery process from, you know, alcohol or opiates or whatever it might be, and you're able to tell someone, this, you know, what you're going through is how I was 7 years ago, but I was able to kind of, you know, pivot and make the changes and start to believe that it's possible. So I think the key thing for all of us is what do we actually believe? And I think a lot of efforts in changing our belief models and our belief system is really, I think that's where the rubber meets the road. If we can find a way to create a different subplot, to create a different story, to kind of manage what's going on in the subconscious. So when we go to bed, what are we dreaming about? What's actually going on in our mind? And that can only happen when you're putting good things into the pot, or you're putting good things like people are experiencing, you know, love and kindness and grace. And I get it. There are certainly a lot of people who will say, but doctor, I've got lots of good things in my life, but I've got a lovely wife, I've got beautiful children, I've got a career, I've got everything, but still, in spite of all that, I'm not able to I still feel bad, and I think what's happening in that situation is that people are focusing more on somehow, and I suppose, you know, the bias, you know, that kind of the negative bias that, you know, the mind tends to almost focus on the negative more than the positive. And a skill that we can all learn is finding a way to almost shift our attention to things that are going to help us. So gratitude practice is so important. You know, how do you get someone to start to appreciate the goodness in their life? And this is something that's so important, because at times you get people who on the surface they look successful, they look happy, and then all of a sudden you hear, oh my goodness, their life, you know, ended by suicide. And it's like, well, I don't get that. What went on here? That, you know, I know the children, I know but the point is, what is the most, I would say, the most prominent thought that's going through their mind on a day day-to-day basis? What is the subplot of their life? So you could have tons of money, you could have tons of property or success in business or whatever. Even in ministry, you could have success, but somehow you're still focusing on something negative. And then that, in spite of the fact that your people think you're great, people think you're good, you are not able to conceptualize that. So you're focusing on something negative. Oh, I messed up, I'm a fake, I've got imposter syndrome, I don't deserve to be here, I'm not feeling it. And then if those thoughts start to gain more traction, then that's when people start, then the negative, maybe you should, those kind of negative suicidal thoughts start to become much more powerful. And then you hear that, my goodness, they've committed suicide. It's like, I didn't see it coming, but the person was struggling. And I think it's certainly worthy of, society, we all need to, I would say, wake up to the reality of who we all are. And I think we need to find a way, if I'm in a family, I need to be looking to the needs of the people in my immediate environment, my wife, my children, and I need to make sure that as best I can that I'm caring for them and they're caring for me. And in that way, the chances that this negative kind of narrative will find a way to kind of gain the ascendancy that will lead to suicide will not happen. And I know at times people say, well, okay, they were bullied at work and so they became so sad, or they were stressed at work, the NHS or whatever, the company, the policies. And those things are real, but if you are able to almost supersede the fact you've been bullied at work, but you're able to get the loving affirmation of a spouse who believes in you, then that can, in many ways, overcome the fact that you've got a dragon as a boss who is telling you that you're no good. It's so powerful. Obviously, people who've been grown up with parents who didn't affirm them as, oh, you're useless, I don't even know why I'm calling you my son, then that sticks with them. And that's telling them. So even when they get to success, that is ringing in their mind. And so if somehow something happens, maybe that is a subplot. My dad said this when I was 12, that you're never going to amount to anything. And I still believe that somehow, even though it's gone, it's a long time, but I still believe that. Then I meet a spouse who somehow we have a problem, and it happens that person says something similar to what, the dad said back in the day. And then I go to work and then then you're looking around, you've got the negative story from 30 years ago, you've got the spouse who is not affirming, then you've got the boss, and then you're looking around, where am I going to get any sense of safety or security or comfort? And then that is bad. And at times that's when people, to blot out the pain, they pick up the bottle, or they go, look for drugs. Or at times the thoughts become so overwhelming that they go into depression, and before you know it, things are getting quite bad. So I would say the approach for me is one of understanding, trying to, as best you can, understand what's going on with people, paying attention to the people in your life, listening, and giving them what you feel that they need and what you need yourself, giving the best you can. Not a harsh, critical spouse can be really, 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 really difficult and even dangerous. Because if you're meant to get love and support from your spouse, but all you're getting is, you're just like your dad, or this, that, and the other, that can really hurt to the core. And so a lot of times when people say, someone committed suicide because of work-related issues, and I get it, work can really cut to the heart and really be very, almost quite, very, very difficult to deal with. But a lot of times you ask yourself, okay, in addition to that, was there anything else to dilute that negativity? And if there wasn't, or maybe you've just fallen out with your spouse, or you've just gone through a breakup, then that at times is just enough to push you over the edge. So we need to look after each other. That's my main message here. Love and compassion, being there for the people in our lives, somehow finding a way to support them, whether we were feeling great or whether we're not feeling great. Just always think, okay, what can I do to be there for the people in my life? Great.
Well, I think that brings us to the end. We've only got you for an hour, so we've just crossed that mark. So there's so much more I wanted to talk about, and got a list of questions. We'll have to get you back some other time and dig a little bit deeper into some of that.
But I think I'll just maybe conclude by saying this, Lester. I think the work you're doing is absolutely crucial. Addiction comes with a whole baggage of emotional stuff, shame, guilt, a sense of, oh, I'm a failure, I've let people down. And those emotions, we've got to find a way to resolve that and find a way to change the what I'm going to call the subplot in the mind of the individual. And that's why when we, in the patients that are, that come through rehabs and through East Coast Recovery, you want to really try and get them to understand that we got here due to certain factors. We are here today because of one thing led to another. And at times it could be peer pressure. I got involved in this. I started drinking. Someone gave me a bit of drugs and then it got out of hand. But then a lot of times it's, what is driving that and what is keeping them in that position. And everyone is different. And I suppose it's important not to generalize, but I would say, people who are going to do well in recovery are people who are willing to ask themselves those, what I'll call uncomfortable questions, as in, okay, how did I get here? What am I doing that I need to change? And the people, I'm sure you've seen this, people who have detox and they come back in 6 months, they've relapsed. Unfortunately, they have not somehow been able to ask themselves the question, okay, who do I need to become? This is how I was when I got into addiction. Who do I need to become? Who do I need to evolve to that? So it's a transformational process.
Yeah. Well, I think people not understanding addiction or emotional processes as well as you're talking about there. I think, they sometimes think that coming and sort of seeing someone like yourself for a home detox or going to a rehab for a detox, because they think that, once they're off the drugs,
substance,
then everything's going to be all right. But it's like, no, that's the self-medication. There's what you need to do. And again, through the groups that we do and through the talks that you give people, we say that you have to, we're offering you a substitute. Yeah. You're going to have to change the way that you live your life, the way that you're thinking. You've got to look at some of that stuff. If you've been abused, whatever difficulties you've got, but we try and help people find a way that they can do that. To say, look, there's a mountain you've got to climb here, and unfortunately, you're not a good climber.
True.
And so we need to help find a way of getting you the support that you need to get you up that mountain.
Yeah.
But not going up that mountain is not an option.
Yeah.
If you want to stay at the bottom of the mountain in that misery and that unhappiness in your short life, that's up to you. We got a team of people, different teams of people that can assess you, find out your needs and get you up that mountain.
Yeah.
And that's our job. It is difficult, but it's possible. And
absolutely,
there's a lot of evidence of that. And it starts from making them phone calls, talking to people like yourself, getting you your medical support, but then getting you your emotional support, your therapeutic support, if that's what you need. Personal trainers, get you whatever it is, whatever your problem is. Let's have a good look at it and take care of them needs. But tell you, look, it is possible to get up the mountain.
Yeah, well, I believe that, and that's why I think the work is vital. Recovery work is important, and I think I come at this really from the point of view of, I think about, families, need to be secure and safe. If you've got maybe a mother who's got an alcohol problem, or a father who's got a drug problem, then
well, even a lot of anxiety today.
Mm.
I think that stems from, the mothers and the fathers. It seems like then that just goes into the children. I grew up in an anxious, angry household, and so anxiety's been a companion in it. And I actually feel that when I hear that young children have anxiety, I feel so sorry for them.
Yeah.
Because I realise how uncomfortable it's been and is still for me if my mind slips into. But I feel blessed that I've got tools and people that can help me out of that place. And I can't. I'm not a believer that I have to do it for myself, but I don't always believe I can do it on my own.
Yeah. Well, I think it's I suppose when you think about society, and how we live our lives, how, the kind of, you could call it the community that exists within the home and within extended family, and it's all about interaction. So human interaction is so important, and it can't be overemphasized, the need to be able to support each other. It's in fact, it's fundamental to what makes us human beings, that kind of social support. Obviously, at times you get, within the smaller family, you've got, romantic connections between husband and wife, etc. But then that whole thing about, we are dependent on each other. There's that, real intertwining of support and dependency and kind of mentoring and help, and it's all part of what makes us human. So all I'm going to say is that I think the work you're doing is amazing. Thank you so much for what you're doing. I think people out there who are faced with addiction issues need to be aware that there is help, and certainly someone who has passed through that journey and really understands it is has not just gone through the process, but has taken time to understand obviously the science and the psychology and the whole kind of the principles that can really help people. I think is certainly put themselves in a position to make a difference. And so so thank you for what you do. We will definitely keep going and try and support each other. I really want to look to challenge, you could call it, existing, what I'll call it, existing, norms and stereotypes. Let's really make our world a better place. Let's try and do the right thing. Let's get our homes to be those bastions of safety that they're meant to be. Husbands understanding what they're meant to do, wives understanding how they're meant to live, how they're meant to talk, to keep things together. Because obviously, if families are together, then the chances are that the children in those homes are likely to be more secure. They're likely to be exposed to less trauma than where things are chaotic and falling apart.
People don't like that, but what I say, and I'll finish on this because I know you've got to go, is that, look, if you get 100 families where everybody smokes, how many of them children are going to smoke? I'd say about 90%.
Yeah, absolutely.
If you get 100 families that the children don't smoke, I should think it's the reverse statistic.
Absolutely. Yeah.
And so, just based on something like that, environment is key. Again, it's not going to solve all the problems, but you can definitely improve the conditions. Again, it's fact for me because I see it all the time. We work with some of the worst families, people with the most difficulties, but when they actually become willing to start addressing them and start heading up the mountain and learning to climb and to change and create better environments, the whole family changes. And we just see it over. So it's not just science, And I know that our society is so far behind in this stuff
Yeah.
that we need to just keep putting this message out and saying, look, we know it's difficult.
Yeah.
It's just we're saying it is possible.
Absolutely.
And you've got to understand that, because the more of us that actually realise that, and the more of us there are, then the more possible it becomes, because then for the other people that we're around, that we can then give them that support. And so, again, I've never been a great advocate of the NHS or government or doctors are going to solve this problem. I believe it's the community. I believe that we all got to take responsibility for our own families, our own communities.
True. Yeah.
And start supporting each other and working together and encouraging each other. Because, again, they say, you know, like for the suicide people, that's always been a shocking statistic to me. That's the biggest killer of men under 40 in our country, like around about 5,000 every year. It's just shocking to me that. But then they say to address this mental health, they say, you know, talk to someone. But again, it's like that's not really good advice. Because most people don't know how to be talked to that way, and they'd probably give wrong advice.
Yeah.
You know, it's all right having this rose-coloured glasses of the world, but, you know, and again, someone that's grown up with a lot of problems, and when you talk to people, they don't want to hear a lot of the time, and it makes you feel more vulnerable, more uncomfortable. So, again, I think it's like, let's start getting some classes teaching people how to support someone with them kind of problems, and realise the importance of it, that you are important to other people's lives.
Yeah, very true.
That's nice. So
thank you so much.
Thanks again. I think we definitely can do this again. Appreciate it. And
I've enjoyed it, yes.
God bless. Thank you very much.
Thank you.